The detection of the rare enterovirus EV-C105 in Spain marks a troubling development in the ongoing surveillance of emerging viral threats. While enteroviruses are not new, their ability to cause both mild and severe diseases, particularly in vulnerable populations such as children, underscores the necessity for heightened vigilance. The fact that this specific genotype had not been previously identified in Spain, yet has now been confirmed in multiple cases, including some with neurological complications, raises serious concerns about its potential to spread and cause harm. The emergence of a new viral lineage with genetic mutations that may enhance its transmission and immune evasion further complicates the situation, suggesting that this virus could be more dangerous than initially thought. The implications of these findings are far-reaching. Historically, enteroviruses have been associated with conditions ranging from common colds to life-threatening meningitis and encephalitis. While respiratory manifestations of EV-C105 were expected based on previous reports, the identification of 2 neurological cases in Spain suggests that the virus may be evolving in ways that increase its pathogenic potential. This is particularly alarming given that neurological infections can result in long-term complications, including paralysis and cognitive impairment, with children being the most affected. The presence of this virus in multiple European countries signals a broader trend that cannot be ignored, as it may indicate that the virus is spreading undetected in various populations. One of the most concerning aspects of this situation is the difficulty in detecting EV-C105 using standard laboratory methods. Unlike other enteroviruses, this strain possesses a divergent genetic region that makes it harder to identify with conventional PCR tests. This means that many cases could be going unnoticed, allowing the virus to circulate silently until severe cases, such as those involving neurological symptoms, begin to appear. The study's findings suggest that current diagnostic tools may be insufficient, leading to a potential underreporting of cases and a false sense of security. If this virus is more widespread than the available data suggests, health authorities may be underestimating its impact and failing to implement necessary containment measures. Another critical issue highlighted by the study is the reliance on traditional sampling methods, which may not be adequate for detecting EV-C105 in patients with neurological symptoms. Enteroviruses are typically identified through stool samples, but emerging evidence suggests that some respiratory enteroviruses, including EV-C105, may not always be present in fecal matter. In the documented cases of neurological complications, the virus was only detected in respiratory samples, meaning that had the standard protocol been followed, these infections might have gone unnoticed. This raises concerns about whether similar cases have already occurred but were simply not diagnosed due to inadequate testing strategies. Without a comprehensive approach to sample collection and analysis, it is likely that many infections remain undetected, allowing the virus to spread unchecked. The emergence of EV-C105 as a potential public health threat calls for immediate action. Strengthening genomic surveillance is imperative, not only to track the spread of this particular strain, but also to monitor possible mutations that could make it even more virulent. The identification of a new viral lineage with genetic alterations suggests that EV-C105 is undergoing evolutionary changes that may impact its behavior, including its ability to cause severe disease. If these mutations enhance the virus's capacity for immune evasion or transmission, the risk of outbreaks could increase significantly, particularly among children and immunocompromised individuals. European health authorities must collaborate to expand databases of viral sequences, ensuring that any further changes in the virus's genome are quickly identified and assessed for their potential impact. Beyond surveillance, healthcare professionals need to be aware of the potential neurological risks associated with EV-C105 infections. Clinicians should be on high alert for unexplained cases of meningitis, encephalitis, or acute flaccid paralysis, particularly in children, and should ensure that both respiratory and stool samples are analyzed when enterovirus infections are suspected. Delayed diagnosis can have devastating consequences, as neurological damage caused by viral infections is often irreversible. Early detection and appropriate medical intervention could prevent long-term disability and improve patient outcomes. But this requires healthcare systems to adapt to the evolving nature of viral threats. The reality is that the appearance of EV-C105 in Spain and other European countries may only be the beginning of a larger public health challenge. Enteroviruses are notoriously resilient and capable of spreading rapidly in communities, particularly in settings such as schools and daycare centers. If preventive measures are not implemented swiftly, the virus could become entrenched in the population, leading to recurrent outbreaks and increased pressure on healthcare systems. The fact that cases have already been documented in multiple countries suggests that transmission networks are already in place, making containment efforts more difficult. Without immediate action, the consequences could be severe. The combination of a virus with neurological potential, inadequate detection methods, and a lack of widespread awareness among medical professionals creates a dangerous situation where infections could continue to rise unnoticed. If EV-C105 continues to spread and evolve, it could pose a long-term threat to public health, particularly for children who may suffer the most from severe complications. Health authorities must take this threat seriously, investing in enhanced diagnostic capabilities, increasing public awareness, and ensuring that medical professionals are equipped to recognize and respond to potential cases. Ultimately, the emergence of EV-C105 serves as yet another reminder that viral threats are constantly evolving, and complacency can have dire consequences. While this enterovirus may not yet be widely recognized as a major public health concern, the warning signs are clear. The time to act is now, before more severe cases emerge, before the virus spreads further, and before the situation becomes unmanageable. If appropriate measures are not taken, Spain and Europe could face a new wave of enterovirus-related illnesses with potentially devastating effects on the most vulnerable members of society.